You've just successfully placed an IV in your patient, but your job isn't quite finished yet. We want that IV to stay in place and stay clean and free from infection. So to make sure that happens, it will need to have a dressing applied. There are many different dressings available, but at Trinity Health Livonia, both the standard Tegaderm and Tegaderm IV Advanced are stocked in all pod rooms. This video will demonstrate dressing application using these two devices. The Tegaderm IV Advanced is available in the pod rooms at Trinity Health Livonia. It functions not only as a line dressing, but also as a very effective securement device to protect against accidental dislodgement or removal. It can be used on all forms of vascular access devices. The dressing consists of 3 parts. They are nicknamed the shirt, the pants, and the belt. They are all connected when you start, and you will separate them as you place the dressing. The shirt is the center of the dressing, and the largest piece. It contains a transparent window in the center surrounded by a more rigid material, and at the bottom of it is a slit. The window should cover the access site completely. You should be able to view the insertion site and the catheter hub easily. Place the shirt positioned to show this, and make sure the slit is pointed down the arm in the same direction as the extension tubing. Gently lay the shirt over the access site. Do not stretch it tight as you place the dressing, because this will put unnecessary pressure on the catheter that can lead to the development of pressure injury. Just lay it over the site, and push it down with your hands to make sure it fully adheres to the skin. The extension tubing should line up with the slit at the bottom of the shirt. Once it is in position, push the 2 pieces of the slit down onto the skin so that the extension tubing is left exiting the dressing from the small hole created about 3/4 of an inch from the edge. Remove the paper frame from the shirt. This will separate the pants and the belt from the shirt. Next, we'll put on the pants. They are made of the same material as the outside piece of the shirt. It is more durable than the transparent window. There is a small U-shaped opening on the pants, and there are also 2 paper tabs on the corners that remain after you peel it away from the paper frame. These are there for you to hold and to avoid the pants sticking to your gloves. You're going to tuck the shirt into the pants, which means the pants will overlap the bottom of the shirt piece. Lift the extension tubing and slide the pants so that the U-shaped opening surrounds the extension tubing, similar to how the tubing sat between the opening of the slit on the shirt. Smooth the pants down, and then remove the paper corners, and gently press the pants down completely. At this point, you should close the slide clamp over the extension tubing. Whenever the IV is not in use, the slide clamp should be closed. With the saline syringe still attached, slide the clamp so that the tubing is pinched and occluded. This is often ignored or skipped, and it will lead to clotting off of the end of the IV in the vein, and ultimately a decreased lifespan of the IV. You should also apply the swab cap to the end of the extension tubing by firmly pressing it over the port. Anytime the IV port is not connected to a syringe or infusion, all ports should be covered with an orange swab cap. The swab cap contains a sponge impregnated with alcohol that protects the end of the catheter from contamination and bathes it in disinfecting alcohol. Finally, it is time to apply the belt. There is space on this piece to time, date, and initial the dressing, and make sure that you do this at this point. Then place the belt overlapping the shirt and the pants where they meet. The belt can also be used to position and hold the extension tubing so that it is directed up the arm, or you could choose to use tape to position the tubing. When the IV Advance is placed correctly, it does an excellent job of protecting the IV from accidental dislodgement. It can be pulled on with a lot of force and still remains in place. Obviously, if someone really wants to pull out their IV, this won't stop them, but it does stop the vast majority of accidents from ruining a good IV. The other dressing option available is the standard Tegaderm dressing. This is a simple, small, transparent adhesive dressing that is commonly used to protect IVs after placement. After your IV is in place, peel the backing off the Tegaderm and lay it over the access site. You want to completely cover the catheter hub and the connection where the extension tubing and the catheter join. Peel off the paper frame from the dressing. There is a label attached to the frame. Time, date, and initial this label and place it directly on the Tegaderm. You'll need tape to further secure and position the IV and tubing. Silk tape and paper tape are stocked in the pod rooms. Paper tape tends to cause less irritation to the skin in some patients, but does not adhere quite as well as the silk tape. Tape also comes in different widths, and silk tape is easily torn in half to get to your desired width. I personally prefer to use thinner strips of tape for my dressings. One common practice is to prep the tape before applying the dressing and stick it to a nearby table or bed rail until you need it. This is not best practice. It introduces a potential infection risk to the insertion site you just created. Tape is sticky, and by prepping in this way, it is stuck to a non-sterile, probably dirty surface, and then carried over and applied very near to a hole in the skin that gives direct access to a vein. Infections can lead to a loss of IV access. And that's really a best case scenario because infections that have a direct line to a vein can quickly lead to life-threatening issues. So unroll your tape as you need it, and use it to secure and position your catheter's tubing. Most people will place a strip of tape along the bottom of the Tegaderm, and then at least one more to position the tubing so it's pointing up the arm. This position can help protect your IV, because if the IV tubing is attached and gets pulled on, it won't be pulling the catheter straight out of the arm, but will instead be pulling in the opposite direction. When you're satisfied with your tape, flush the catheter, close the slide clamp, detach the flush, and apply a swab cap. The standard Tegaderm does little to secure the IV, which is why the IV Advanced is such a useful tool to have. Pulling on the IV Advanced requires a lot of force to dislodge the catheter from the arm, but it doesn't take as much effort to lose access with a standard Tegaderm. At Trinity Health Livonia, IVs can stay in place as long as they are functioning and free of signs of infection. But the dressing will need to be changed more regularly. If it ever becomes soiled or is starting to peel up, it should be replaced. It also must be replaced at least every 7 days. This is why timing and dating the dressing is so important. If you can't figure out when a dressing was placed, it needs to be replaced during your shift, and make sure you time and date the new dressing, and chart the dressing change in Epic. Getting successful IV access can be difficult, but your job isn't done until you've dressed the IV. Having a good, clean dressing will help keep your IV in place and functioning for a long time.